Now to our GMA cover story. It's more on actress Christina Applegate announcing she's been diagnosed with multiple sclerosis. Let's check back in with Chief Medical Correspondent Dr. Jennifer Ashton. And Doc, thank you for being back with us. Can you explain what MS is and how it affects the body?
So if you think of it as a neurologic condition affecting the central nervous system with an immune component, imagine that our nerves are a hose and it needs that insulation to get the water from point A to point B. You can think of MS as lots of little holes there, so it leaks and it disrupts the passage of those those signals in the central nervous system.
And I know we talked about it a little bit earlier, but what are the symptoms and how is it diagnosed?
So symptoms range. They run a spectrum depending on where in the brain the MS is occurring. It could be fatigue, it could be speech problems, bladder problems, motor or movement problems, and the diagnosis is really a comprehensive one. Sometimes it's a diagnosis of exclusion, but it includes a good medical history, a full neurologic exam, then often an MRI of the brain and some blood tests and a lumbar puncture, spinal tap. And usually with all of those things, the diagnosis can be made, but it can take a while.
But women are 4 times more likely to be diagnosed than men. Do we have any idea why?
Unfortunately, we don't, but this is a great example of how the same condition, MS, really presents differently based on gender. There is an interesting association with pregnancy, though. A lot of times, pregnancy, obviously a powerful hormonal condition, can cause kind of a protective or abating in the symptoms or disease progression, and then a lot of times, unfortunately, women will get a flare postpartum, so that hormonal contribution not well understood.
And sometimes, you know, it's been mentioned that low vitamin D also may contribute to that. What do we know about that and other risk factors?
Yeah, so in terms of risk factors, it's really unclear other than gender, of course. Some people find obesity, smoking to be associated risk factors, but the vitamin D link, there is some research that really does suggest an association, I want to be clear, not a cause and effect, between low vitamin D levels and MS. So again, we know that vitamin D has an impact on the immune system. There could be something there, but definitely needs more research, and awareness is so important. So when a celebrity like this comes forward, a lot of people learn about this condition.
And Doc, when you speak, people can listen and get more information from you, which we always appreciate. Thank you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.